any tenderness?
No.
No? Okay, I'm gonna look at your eyes now. Good hair distribution. I don't see anything wrong with your skin, no redness. Look very symmetrical to each other. Okay, so that's within normal. I'm gonna look at your eyelids. Close your eyes for me. I'm gonna open. Position's good, symmetry is good. Blink for me a couple times. Your blinking looks within normal and looks like a good color. Looks like it matches the rest of your skin. I'm gonna look at your conjunctiva. Nice and red. Clarity is good. Nice and white. Now I'm going to look at your iris. Iris looks very round and the color looks right on both sides. Now can you close one eye for me? We're going to look at your near vision. How many fingers am I holding up?
1, 4.
Okay, near vision looks good. Now we're going to do your ocular vision in the 6 cardinal visions. Okay, that looks good. And then we're going to do your peripheral vision. Now tell me how many fingers I'm holding up.
2.
Good. Peripheral vision looks good. Now we're going to look at your pupillary response. Pupillary response looks good. Consensual reaction is good. And your accommodation to light is very good. So that is all within normal. I'm going to examine your ears now. Your external ear looks like it's very aligned. It's in the right position to your head and it looks like a good size. Your shape looks fine and they're very symmetrical. They are attached to your head and the skin color looks within normal. So now we're going to look at your auditory canal really quick. I don't see any discharge. I don't see any lesions. Now we're going to inspect your skin. Don't feel any edema or arrhythmia. I don't see any redness, so that's good. So that is all within normal. Now I'm going to palpate your mastoid areas. Any tenderness?
No.
An external ear, any tenderness?
No.
I don't feel any edema in these areas or any nodules or bumps or redness. I'm going to do your whisper test now. Tell me what you hear. Samantha?
Samantha.
Good. So the whisper test is good. So your hearing is good. Now we're going to look at your nose and mouth and your oropharynx. Nasal structure looks good. Septum looks very symmetrical within normal. Your nose looks like it has good patency. Nothing wrong with it. And your nasal turbinates are within normal. I don't see any nasal discharge coming out, so that is good. It looks healthy. Now I'm going to look at your lips and your gums and your mucus composal. Good symmetry, good color. Let me see your teeth. Good. Looks like you have the right size and number. Good position. Color looks good, and they are very aligned within your mouth. You have very good hygiene. Looks like you brush your teeth well, and the condition of your teeth is very good. So that's within normal. Can I look at the floor of your mouth? Floor of the mouth look good. Hard and soft palates look like they are good surface characteristics. The color is within normal, so that is good. Now I'm going to look at your oropharynx. Let me see. I don't see any odor. Your posterior and anterior pillars are good. And your uvula, say looks good. And your pharynx looks fine also. Now let me see your tongue. Can you move it for me? Movement looks good. Surface characteristics look good. And the color looks good, which is all within normal. I'm going to palpate your mandibular joint. Can you move it for me? Good movement. I don't see any clicking. Does this hurt at all?
No.
Okay, good. Now I'm going to look at your neck, okay? Symmetry of the neck look good. The trachea is aligned in the middle. Your thyroid looks fine and your venous pulsations look good. Now I'm going to look at your neck for any range of motion. Can you move it for me left and right? Good. Range of motion is very good. Now I'm going to palpate your neck straight. Can you turn your head against this? On the other side? Good neck strength. And then now you're going to lean it to your side against mine. Good. And then now you're going to shrug the shoulders for the deltoid strength. And that looks good also. So now I'm going to palpate your trachea. Very aligned. Good symmetry in the right spot. I'm going to do your lymph nodes. Does any of this hurt?
No.
Okay. Size looks fine. I don't feel them, so that's good. And no tenderness. I'm going to do your choroid pulses. Amplitude is +3. Now I'm gonna look at your arms, okay? Can you roll these up for me? Skin characteristics look good. I don't see any I don't see any bad color. Color is normal, no deformities. Now I'm gonna palpate your elbows and wrists. Any tenderness?
No.
The temperature looks good, and I do not see any deformities on either of them, so that is all within normal. Now I'm gonna do your brachial pulse. Brachial pulse is a +3. Now let's do your radial pulse. Radial pulse is also a +3, so that is within normal. Now I'm going to do your epitracheal lymph nodes. Let me know if any of this hurts. Any of that hurt?
No.
No? Okay, no tenderness. Size is within normal. Now we're going to do your strength. Can you go against me? Triceps and biceps looks like in good strength, and then grasp my finger. Okay, looks within good. Now we're going to do your reflex on your arm. Brachioradialis, reflexes look good. And then we're gonna do your hands now, okay? Let me see both your hands. Color looks fine. Temperature feels within normal, and they feel moist, but not too moist, looks within normal. The symmetry of the hands look good, so that's within normal. Doesn't seem anything wrong. Now look at your nails. The shape is good, very symmetrical, good contour. Seems within the right color, thickness is good, and it seems like you take care of your nails. They are very clean, so that is good. Now look at your capillary refill now. Capillary refill is good. And then let's see, clubbing. I do not see any clubbing. Okay, so now we're gonna do your back. Can you go on to your back for me? Spine alignment looks good. Posture looks good, and scapular movement looks good. Can you sit up for me? Is it? Yeah. Rhythm of respirations are good. Breathe for me. Your depth looks good. So your skin is very intact. No lesions, and the color looks good. It doesn't seem like you have any scars right now. You have a good symmetry of your back, and you have a good posture. I'm going to palpate your vertebrae. Does this hurt at all?
No.
Okay, and it is very aligned like it should be. Now I'm going to palpate your posterior chest and your muscles. Does anything hurt?
No.
Any bulges?
No.
And it is very symmetrical and aligned. Now I'm going to palpate for phromitis. Can you say 99?
99. 99. 99.
And no signs of phromitis. So now I'm going to palpate can you breathe in and out for me? One more time. Good expansion. Does this hurt?
No.
Okay, your costibral angle is not tender. Now I am going to listen to your breath sounds in your posterior chest. Breath sounds are within normal. Now I'm going to look at the front, your anterior chest. Can you turn this way for me? Can you breathe in and out? Ease with respirations is good. Good symmetry, and your posture looks very good, so that's good. Now I'm going to look at your precordium, which is this area. I don't see any heaving, don't see any pulsations that shouldn't be there, so that looks all within normal also. Your skin color looks good. It's very intact, and I do not see any lesions, scarring, redness, nothing that shouldn't be there, so that's all within normal too. So nothing to worry about. Can you say I'm 99 for me?
99. 99. 99.
No signs of phromitis. Now I'm going to listen to your breath sounds on your anterior chest wall. Anterior chest sounds look good. I'm going to listen to your rhythm now. I don't hear any murmurs, and your heart sound fine. Your S1 and S2 sound just fine. Can you lay on your back for me so I can check your abdomen? I do not see any peristalses or pulsations that shouldn't be there. Your contour is very good in your abdomen. Your skin characteristics are good. And in this area, I don't see any scars or lesions from your pubis area up. Your vascularity looks within normal, and I don't see any bulges, and your navel area looks good. We're gonna check for the strength of your abdomen. Abdomen strength looks good. And then can you raise your head up for me? I do not feel any umbilical hernia, so that is within normal, so that is good. Now I'm going to listen to your abdomen sounds for bowel sounds, okay? All 6 regions. Bowel sounds sound fine. I'm going to check if you have any bruits or hums. I do not feel any, so that is all within normal. I'm going to palpate a little bit. Does this hurt at all?
No.
Any tenderness?
No.
I don't feel any masses, no pulsations that shouldn't be there. I feel your lymph nodes right here. Your femoral pulses are a +3, so that sounds fine. And you don't have any bulges. That could be a hernia. So that is all good and within normal. Now we're going to assess your legs, okay? Can you sit up for me? I'm going to assess your leg and ankles. Skin characteristics look good. Vascularity is within normal, and hair distribution, no deformities, very symmetrical. Temperature looks fine, so that is all within normal. Now I'm going to palpate your lower legs. I feel pulses, temperature looks good, and deformities are non-existent, so that looks good. Now I'm going to look at for pitting edema. I do not see any edema, so now we're going to bend your knees are bent, so your hip flexion is good, so you're going to look at your quad. Can you put it up for me? Okay, good. Now you're going to flex your knee for knee flexion. Dorsal flexion, can you put this up? And plantar flexion down. Okay, those are all within normal, so that is good. Now we're going to test for your deep tendon reflexes on your patellar area. And go like that. Deep tendon reflexes are within normal, so that is good. Now I'm going to do your posterior tibia pulses. That's about a +3 normal. +3 normal, and then we're going to look at capillary rate flow.
Now with the elbow on the table, can you do this? Can you put your hand flat on the table for me? And can you turn your pinky like this? Okay. And now can you do the same, but bring it toward your hand towards your thumb like so? Good. Alright, now we're going to move on to your fingers. And so for this, I'll need you to make a fist. Just get a little closer to you. Okay, good. You can relax. Now, can you make this fist with your fingers curled like this? Okay. Good. And this. Oh, thank you. Now for this part, can you lay your hand flat on the table like so? Can you bring it a little towards me? Thank you. And so I'm going to place this ruler in your palmar crease, and I'm going to have you try and curl your finger and touch the goniometer and slide it down as low as you can. Okay? Perfect. One at a time. Okay, so let's start there. Okay, now with this finger. Okay. Good job. Okay. Okay, good. Now can you oppose your fingers one at a time? Good. Now we'll move on to manual muscle testing. So if you can start out with your hand like this and turn it towards you. Yeah. Good. Then I'll be able to grab you. So hold there, don't let me move you. Good. Now in that position, go towards your thumb. Hold there, don't let me move you. Good. So bend your wrist up like so. And can you turn your hand towards your pinky? Okay. Hold it there, don't let me move you. Okay, now turn towards your thumb. Hold it there, don't let me move you. And then if you can scoot in a little more and tuck your elbow with your arms still like this. Turn towards your thumb. Hold it there, don't let me move you. Good. Now you can relax. And can you put your palm flat on the table for me? Okay, we're going to check this muscle one at a time and have to hold your other fingers down as we go. So can you curl your pinky upward? Hold it there, don't let me move you. Good. Curl this finger up. Hold it there, don't let me move you. Good. Curl this finger up. Hold it there, don't let me move you. Good. Curl this finger up. Hold it there, don't let me move you. Good. Relax. Curl your pinky up. Hold it there, don't let me move you. Curl this finger up. Hold it there, don't let me move you. Curl your middle finger. Hold it there, don't let me move you. Curl this finger. Hold it there, don't let me move you. Got it. Now with your hand, pretend like you're a duck. But do it like this. Okay. Hold it there, don't let me move you. 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 Good. Now can you do the UT sign? Longhorns. Okay. Hold it there, don't let me move you. Hold it there, don't let me move you. Okay, can you spread your fingers on the table like so? Hold it there, don't let me move you. 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 Okay, now can you do this? Hold it there, don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. Good. And now can you, oppose them? I'm going to try and roll your pinky apart. Hold it there, don't let me move you. Now I'm going to try and roll your thumb. Hold it there, don't let me move you. Good. Now with your hand like this, can you do your, bend your thumb this way? Good. Hold it there, don't let me move you. And now tuck your thumb all the way in. Hold it there, don't let me move you. Good. Now play some more. Hold it there, don't let me move you. Hold it there, don't let me move you. Okay. Now can you hold your fingers flat on the table? And hold your thumb in. Hold it there, don't let me move you. Good. And then if you can do this, go like outward, yeah. Hold it there, don't let me move you. And then lastly, we need to do, so with your hand on the table like so, can you flex your wrist all the way, but keep your hand flat, good. Hold it there, don't let me move you. Hold it there, don't let me move you. Now can you turn it all the way that way? Hold it there, don't let me move you. Hold it there, don't let me move you. And then now, can you lean forward on your elbow? And then bring it all the way back. Really good.
So we're gonna start with the blood pressure here. And before I do her vitals, I'm just assessing her general appearance, her posture, that she's answering me and answering my questions thoroughly. She doesn't have any slurring or anything of the sort. Start here. So I stopped hearing her pulse around 130, so I'm just gonna pump it up here. Great, so your pulse is around 125/80, so right around normal range. Sorry. There we go. Okay. And next I'm going to do her temperature. So if we weren't using masks, I would do it in her mouth, but I'll just do it right now in the auxiliary. This thing isn't working right now, but it would normally be around 36.5 to 37.5. And next I'll take her SpO2. So her SpO2 is around 96, which is within normal range, between 95 and 100. And then can I just see your wrist here? I'm just going to take her radial pulse. So normally I would take it for a minute, and the range would be between 60 and 100. And I'd also be watching her respiratory rates to just make sure that it's between 16 and 20. Okay. Are you having any pain today?
Yes, in my ankle.
In your ankle? And when did that pain start?
It started yesterday.
Okay. And what brought on the pain?
I tripped on the stairs.
Oh, okay.
Yeah.
And how would you describe the pain? Is it like achy, sharp, dull?
It's achy now. It was kind of a sharp pain when it happened.
Okay. Okay. And does anything make the pain better?
Yeah, icing my ankle. And
Yeah.
I've been taking Tylenol.
Okay. Good. And does anything make the pain worse?
Yeah, I tried to go for a run this morning and that didn't happen.
Okay. Okay. So I'm just going to go on to the neurological assessment now. So I'm just going to assess her level of consciousness. So do you know your name?
Yes.
Okay. Can you tell me where you are?
We're at the hospital.
Okay. And can you tell me the date?
It is September 7th, 2021.
Perfect. Great. And now I'm just going to look at her face, make sure that there's facial symmetry, that there's no
Deformity.
deformity. That's it. And yeah. So gonna move on. I would also do her pupils. So if I had a pen light, that would be good to watch her pupil dilation. Can you just follow the pen here? Perfect. So I can see that. And she's oriented. So now I'm going to move on to the cardio assessment. So I'm going to just take her apical pulse. That's okay. And are you having any chest pain or anything like that?
Nope.
No concerns in that way?
Nope, I'm not on any meds or anything.
Okay. And can I just check bilaterally your radial pulse? Perfect. Just making sure that they're even there. I can feel it on both. And then I would check normally her pedal pulses here. And then I would check if there's, do you have any tenderness in your calves?
Nope.
Okay, perfect. Okay, next I'm going to move on to the respiratory assessment. So do you have any shortness of breath?
No.
Do you have a cough at all?
Nope.
Any wheezing or anything like that?
Nope.
Okay, so what I'm going to do is I'm going to also take her lung sound. I'm going to start back here. Okay, so when I move the stethoscope, just take a breath. Okay. Perfect. So in the back, it's all clear there. Okay. Okay, perfect. You're not on any oxygen therapy? Okay, perfect. You never have been?
No.
Okay. Next, I'm just going to move on to your abdomen. Could I have you lay down? Is that okay?
Sure.
So could you tell me when your last bowel movement was?
This morning.
Okay, and was it normal for you?
Yep.
Of normal color consistency?
No, it was brown informed.
Okay, and your diet, is it regular?
Yep, it's
Normal.
regular.
And if she wasn't wearing a mask, I would inspect her oral cavity, make sure that it's pink and that there's nothing wrong in that area. Next, I'm going to just inspect her abdomen, and then I'm going to also listen to her bowel sounds here. So I'm just going to listen here. I wasn't hearing anything, I would just continue to listen for 5 minutes on each quadrant. And now I'm just gonna palpate, and I'm just gonna see if there's any masses or distension or anything like that. Okay. Okay, and then if I would do deep palpation as well. And are you having any pain in that area?
Nope.
Nope. Perfect. Okay, and can you tell me with your when you last voided?
This morning.
And was it normal for you? Like, what color was it?
Yeah, it was normal, light yellow.
Okay. Do you have any burning or itching or discharge or anything like that?
Nope.
Okay, perfect. You can sit up if you'd like. Great. And so now I'm going to do a musculoskeletal assessment. So I'm just going to have you, do you have any, besides the ankle, do you have any pain anywhere else?
Nope.
Okay. So can I just have you, I'm going to put my hands like this. Can you just push up? Yeah. So you can see she has strength there. Push down. Perfect. Can you do this with your, great. Inspecting that. You can move your wrists, okay? With your lice, can you just bring them back and forth like that? And you can rotate, okay? Is there a little bit of pain?
It's a little painful.
Okay, okay. You can stop there. So I'm just inspecting as well. Throughout the assessment, I'm inspecting her skin. So do you have any burnt, like itching or dry skin?
Nope.
And I'm inspecting if there's any peripheral edema as well. And just noting for that. Can I get you to walk this direction? Perfect. Yep. So I can note that there's no gait or she's able to walk, okay?